Welcome to Nourish MD, Doctor Dietitian Dialogues, where doctors and dietitians empower you about your health and discuss and provide a better path to health and wellness. Proudly presented by Concierge Medical Practice Private Physicians Medical Associates, PPMA, with your hosts, registered dietitians and nutritionist, Lauren Papanos and Romana Brennan.
Hello, everyone, and welcome to the Nourish MD's podcast. I'm one of your hosts, Lauren Papanos. This is your other host, Romana Brennan. And today we are joined with Dr. Boz. Dr. Boz is a rheumatologist with UC Irvine, and he's going to be talking with us about a lot of different rheumatological topics today. And we're really excited for this conversation. We're going to explore things like inflammation and arthritis and autoimmunity and chronic pain. So thank you so much, Dr. Boz, for being here. And let's get into today's topic.
Thank you very much for inviting me to your podcast. My name is Dr. Farshid Bozorgnia with Dr. Boz. I'm a rheumatologist at the University of California, Irvine. I've been practicing rheumatology for the past few years. I went to medical school in Wayne State University in Detroit, finished my residency at Henry Ford Wayne State program. I did my fellowship in rheumatology in University of Toledo. And I've been with UCI since 2022.
Wonderful. Thanks so much. And in all of your experience within rheumatology, what do you find are the top 5, let's say, most common rheumatological diseases or conditions that you see amongst your patients?
So that's a great question. Is that the top 5 rheumatological conditions that we see and encounter in rheumatology include usually rheumatoid arthritis, lupus, ankylosing spondylitis, gout, and even old school osteoarthritis. Each of these conditions obviously presents their own unique challenges, and we are really committed to provide comprehensive treatment for our each patient based on their individual needs.
Yeah, absolutely. And how do these conditions and diseases relate specifically to inflammation as a whole?
So all of these rheumatological diseases are characterized by inflammation. Inflammation is body's natural response to injury or a harmful stimuli. In these conditions, immune system mistakenly attacks healthy tissue and leads to chronic inflammation. And this process can damage joints, soft tissues, and causes swelling, pain, and discomfort, and I would say, other symptoms, including poor quality of life.
Wonderful. And you mentioned that there's a couple of different types of arthritis that you see. And I think that our patients would love to hear a little bit more about what those differences are in those types of arthritis. But maybe you could just start with traditional arthritis. What are some of those common symptoms that most patients present with before a diagnosis is made?
So arthritis commonly refers to inflammation of the joints. And common symptoms include pain, swelling, stiffness, and reduced mobility. It can affect patients actually of all ages and backgrounds. Early diagnosis and treatment is actually key and crucial for managing these conditions effectively to prevent further damage and improve quality of life.
Wonderful. And as I alluded to, there's different types of arthritis. You mentioned osteoarthritis being a type. Can you tell us what are the differences in these types of arthritis and what are the types of arthritis?
So there are more than, I would say, probably 100 types of arthritis, but the most common types are rheumatoid arthritis, osteoarthritis, psoriatic arthritis, and gout. Each one has distinct features and requires tailored treatment for approaches. For example, osteoarthritis is mainly a wear and tear disease of the joints, and versus rheumatoid arthritis, which is an autoimmune disease, meaning your immune system attacking your own joints. And that's a hallmark difference between an inflammatory arthritis versus non-inflammatory arthritis, which would be osteoarthritis, for example.
Interesting. I didn't realize that gout would be considered a type of arthritis.
Yes.
Yeah,
That's very
So
fascinating.
gout is a crystal-induced arthritis, basically. So your body produces uric acid, and uric acid can accumulate in your joint and actually causes chronic inflammation, damage, erosions, and which can be debilitating.
It's amazing.
That's so interesting. So as it pertains to arthritis, more so the osteoarthritis, this kind of wear and tear level of arthritis, is some of that normal as we age? And to what extent, if you believe some of it is normal?
Yes, great questions. Actually, some of it is very normal. As we age, I mean, we all have some genetics, and we were born with, and our lifestyle, obviously, is very important. Occasional joint pain and stiffness is normal, especially with age. As we age, our body starts deteriorating. Your joints are just like your heart, just like your brain, just like other organs. They start deteriorating. However, once it becomes persistent and severe symptoms, then it has to definitely be evaluated by a healthcare professional. So,
And then are there any preventative measures that you found can help slow the progression that you're describing?
great question again. Some factors, just like aging and genetics, are beyond our control. We can modify them, obviously, at this point. However, adopting a lifestyle, maintaining a balanced diet, regular exercise, managing stress, that can help prevent arthritis progression, especially at younger age. People who work out, who do strength exercises, and kind of adapt a healthy lifestyle, diet that can kind of, I would say, at least not prevent totally, but it can lengthen this process or prolong this process from happening, basically. So early intervention and appropriate medical guidelines are essential.
Yeah, I know that with osteoarthritis, it tends to be more common in athletes or former athletes. Is that correct? Because there's more wear and tear.
True.
Yeah.
Yes, this is very important. However, again, I think it would be spectrum. Let's put it that way. So if you don't exercise, that by itself, obesity is a risk factor for osteoarthritis. At the same time, if you do too much exercise, too much stress on your joints, that's a risk factor as well. So moderation, I would say, because you want to actually make your muscles and your soft tissue stronger, that it can hold your joint. That's what holds your joints and prevents the further damage at the same time. But obviously, overuse as well is one of the causes of osteoarthritis.
Sure. Okay. And you mentioned rheumatoid arthritis having a bit of a different causative factor and it being autoimmune in nature. And I know as a rheumatologist, you obviously work a lot of autoimmunity as well. And there was a statistic or a study that came out this year that showed that today that we're seeing autoimmune conditions affect 1 in 10 people. And I think that as dietitians, we see that as well in our office too. And so I'm curious as to, I'm sure you see that, Dr. Boz, right, in your office, that it's more and more prevalent. And is there any idea as to why is this becoming more and more prevalent? Why are we seeing more cases of that autoimmune arthritis?
There's a definitely increasing prevalence of autoimmune conditions. Now, as you mentioned, it's affecting 1 out of 10 people in the world. And it's a concerning trend. Factors such as obviously genetics and environmental triggers. So these goes hand to hand. Genetics, as I mentioned, is something that at this point we cannot change, maybe in future, but not now. But environmental triggers and lifestyle changes may contribute to this rise. And I think part of it is actually the food that we put in our body, the exposure that we have, the air that we breathe in. I believe that more research is needed to fully understand these dynamics and develop these effective preventive strategies, I would say. But it's a concerning trend.
Absolutely.
Why do you think that this type of autoimmunity develops? Obviously, we have these triggers. Do you find that these triggers are the causative effect, or might these exacerbate underlying autoimmune conditions?
Great question. It's hard to say causation, maybe association, is a better word, I would say. So what happens is we have some genetic predisposition, and sometimes we don't have that trigger, that environmental trigger, and we can just have a normal life. But once we have that trigger and we have that predisposition to genetic predisposition that we have, which can trigger the autoimmune diseases. Autoimmunity develops when immune system loses its ability to distinguish between self and non-self, and which leads the attack on healthy tissue. As I mentioned, genetic predisposition and environmental factor can both contribute to development of autoimmunity.
Enhance your wellness with PPMA's full script service. Our platform offers personalized supplement plans, easy online ordering, and fast delivery right to your door. Whether you're looking to boost your immune system, improve energy levels, or support overall health, FullScript has you covered. Visit privatemds.com to learn more and start your personalized plan today.
Speaking on these dietary, maybe nutrition related triggers, as well as environmental triggers, have you found any specific strategies to be particularly helpful for your patients who are struggling with these autoimmune conditions?
Great. Although there's no specific time where triggers universally accepted or applicable at this point, definitely certain life events such as infections, hormonal changes, exposure to environmental factors may contribute to the onset of autoimmunity. Research has definitely shown that the food that we put in our body is one of the contributing factors that can lead to autoimmune diseases, especially lupus as well. For example, I always talk to my patients about anti-inflammatory diets, and which means diet that is not man-made. I tell them all the time, avoid anything that is white rice, white sugar, white flour, basically, and eat whole foods, grains, chia seeds, turmeric, saffron, omega-3 rich diet, which is fish, obviously, or that Mediterranean kind of a diet. So that kind of, I think, that helps really at least progression or maybe prevention or delay of the onset of autoimmunity. It's obviously, I've observed that holistic approach is often beneficial for managing autoimmunity. As I mentioned, this includes focus on healthy diets, minimizing environmental triggers such as stresses, hormonal imbalance, and incorporating stress management techniques, I would say.
Wonderful.
Yeah, I mean, you're definitely speaking our language there in terms of what we would recommend as well. And I know that with rheumatoid arthritis, just as one example, that a lot of times it's not alone in the autoimmunity piece of things, right? That sometimes there's other autoimmune conditions that may be coexisting when there's rheumatoid arthritis. Is that generally what you see as well? That generally someone has an autoimmune disease and then they get diagnosed with rheumatoid arthritis or vice versa? So
diagnosing of autoimmunes is very challenging because we don't present like a textbook at the very first day. And what happens is once you have one autoimmune disease, you are prone to have other autoimmune diseases, and they go hand to hand a lot of times. There are patients who have lupus and have rheumatoid arthritis. You have thyroiditis. You have like Hashimoto's, which is an autoimmune disease. A lot of people don't know that. I mean, we see patients with low thyroid levels, and most of them actually have had autoimmune diseases leading to low thyroid. So once you have one autoimmune disease, yes, you are prone to other autoimmune diseases as well.
Yeah, I'm sure as a rheumatologist that your job can be challenging because I'm sure a lot of patients when they come in, they present with more subjective symptoms of pain, and it might be hard for them to really identify and like quantify what they're feeling, right? And of course, there's a lot of objective measures like lab testing and diagnostic testing and things, but I'm sure that can pose a little bit of a challenge in some of the conversations you're having with patients. And I know that, a lot of people, they might say that they have chronic pain, they feel in pain every day. And I know that pain can be, like I said, a bit kind of hard to quantify in terms of what that is showing up as for someone. But I'd love to hear just a little bit more about how do you approach this conversation of chronic pain with patients, and what does that conversation look like in your office when a patient comes in and just says, I'm in a lot of pain, doc, I don't know why.
Yeah.
So chronic pain, as you mentioned, is a significant challenge, affecting, as you mentioned, 21% of adults in the United States of America. My approach involves comprehensive assessment to identify the underlying cause. That's very important. Before we label somebody with chronic pain syndrome, or just sometimes it labeled as fibromyalgia, we have to rule out other causes of chronic pain, hence autoimmune diseases, non-radiographical axial spondylitis, for example, another one as well. And my treatment usually includes combination of obviously medicine, lifestyle modification, physical therapy as well, and rarely surgical intervention, which I refer to my surgical colleagues for that. But I think the main thing is to realize what is the underlying cause of that pain.
Yeah.
Is there an autoimmune inflammation, basically related pain, versus non-inflammatory pain?
Piggybacking off of that, what would you say? I know you mentioned a couple different diagnoses of these autoimmune conditions. What are some of the other common causes that you see? Are these conditions? Are these triggers? Can you just talk us a little bit through that process?
For sure,
maybe of how you check the boxes off and go through that process.
So the very first thing that I do when the patients come in, I try to evaluate them to see if their pain is inflammatory versus non-inflammatory. Is this from, for example, osteoarthritis or rheumatoid arthritis? Common causes and conditions of chronic pain can be arthritis, as you mentioned. There are mentioned many of types, and the 5 types are the most common that we see. Fibromyalgia, neuropathy actually can be a common cause of pain, and so that it's hard for patients to distinguish, the neuropathic pain versus inflammatory pain versus non-inflammatory pain. And I think identifying specific cause is crucial to develop effective treatment plan for the patients. Not always we're successful to find out what's the true cause of the pain is, but at least we can try our best and see if we can come up with an underlying disease that it causes chronic pain.
In your conversations with patients in your office, is there some of those sources of chronic pain that you find diet to help support? Like if someone has inflammatory chronic pain, do you find that an anti-inflammatory diet is more effective for them than someone that you determine doesn't have inflammatory pain?
Oh, definitely. Mm-hmm. Definitely. Especially younger females, I would say, or in the middle-aged females. That's what I realized, actually. A lot of it is actually diet-related. And I've had patients with fibromyalgia, with chronic pain, with mild inflammatory conditions where diet modification has been very successful. And at that kind of cleansing that you receive from diet modification, avoiding the triggers, for example, the man-made food that we call, I remember a long time ago, I had a mentor of mine who told me, when you put something in your mouth, you have to see if there's a mother or father. Where's it coming from? So
not a chemist.
Not a chemist, exactly. So that's very important. I think there's a fantastic book out there. It says Goodbye Lupus, and it's actually written by a doctor who suffered from lupus, and she was able to manage her lupus with diet modification. Again, that in the milder form is very definitely. I think this is needs to be part of the treatment plan for every. It's not that it will substitute medication, but it definitely has to be part of the plan for any person with inflammatory disease.
Sure. And what are some of the other types of alternative support outside of medicines that I'm sure differs depending off your diagnosis of the patient? Is there anything else like exercise or like acupuncture or anything of that sort that you've seen to help in these cases of chronic pain?
I believe that individualized treatment plan are the key. As you mentioned, this multimodal approach, combination of diet modification, medication, physical therapy, lifestyle medications, acupuncture, as you mentioned, yoga, tai chi, can be very, very highly effective, actually. Additionally, I would say addressing the physiological aspect of the pain through counseling and stress management also plays a crucial role as well. So I think this multimodal approach to the patients with chronic pain, chronic inflammatory pain is the key to success.
And we've talked a lot about utilizing these different strategies as to help manage with these symptoms, maybe to prevent further development of these conditions. Do you notice with some of your longer term patients that this is effective long term, that we can treat these conditions, or is the primary goal to manage these as best as possible?
I always used to say that treatment, a definite treatment for any condition is mainly infection. Everything else is managed, I would say. Effectively managed. These are long-term management plans. I mean, lifestyle modification, diet modification are long-term. You have to, for the rest of your life, you have to stick to these plans. And this is the key. Yes, I believe I've had some success for my chronic pain patients, for chronic lupus patients and inflammatory pain, that through diet, lifestyle modification, and I think with the minimum amount of medication if needed, they've been really successfully managed their condition. But again, part of it is, patients willing to do the hard work as well. And exercise is the key. And one of the keys is exercise is anti-inflammatory. A lot of conditions, our conditions improve with activity, improve with exercise. So these are very important, I think, aspect that we have to look into.
Wonderful. Dr. Boz, is there anything that we haven't asked you about that you're just dying to tell our patients about that maybe you're seeing in practice or any just revelations that you wanted to share with our patients today?
I think it's very important for patients to take their condition seriously and be their own advocate first and foremost. And part of it is embracing healthy lifestyle, healthy diet, regular exercise, and eating that anti-inflammatory diet that I mentioned. If they're interested, obviously, in learning more about us at UCI Rheumatology, we're happy to see them and provide care for them.
Yeah, and you guys are located just right down the street from our offices. Yes. So it's just an easy walk over or drive over. So it's very, very local to the PPMA offices. And if you are looking for a referral, feel free to give our office a call, and whoever your physician is can provide that referral over to Dr. Boz over at UCI Rheumatology.
Thank you so much. Appreciate it.
Thank you for your time and your expertise today.
Thank you so much for having me. It was a fantastic opportunity. Thank you. And I hope to talk to you guys later again.
Thank you.
Thank you for joining us for today's episode of Nourish MD, Doctor Dietitian Dialogues. This podcast is intended for general educational purposes only. It is not a substitute for professional medical advice. Please consult with your healthcare provider before beginning any nutrition or supplement recommendations. Sign up for our mailing list so you'll never miss an episode of our wellness journey. See the podcast description for the link.